we've been able to show both in the model that we have the most experience with, but other folks in the field, that the critical aspects of vaccine design include both understanding what are the right antigens to focus on, and what is the role, for instance, of shared versus neoantigens, and that being a particular area of focus and interest, how to present the antigen in the right way, so creating a platform that introduces co-stimulation. And we've learned a lot from CAR T cells about the importance of the stimulatory sort of influences that govern whether T cells become activated or rest down. And so we have, in our particular setting, a model that we can accomplish both those things, a presentation of multiple antigens, and doing them on a platform of dendritic cell co-stimulation so that we can generate robust T cell responses. I think the third leg of that that's very important, of course, though, is overcoming the tumor microenvironment and trying to understand in different settings what are the challenges for that. And in that way, I think much of immunotherapy, as we think towards the future, whether it's about vaccines or CARs, is going to really be about how to integrate different strategies together so that are there settings where amplifying a T cell response through a vaccine is enough, and that is going to yield something very important clinically? Are there settings where that's a first step, but one needs to figure out how to create better persistence for those T cells? What are the immune regulatory mechanisms that would defeat an immune response, and how do you modulate them, whether it's through targeted therapies or other immunoregulatory treatments, and how these things then integrate with each other. So as an example, we have an area of focus looking at how CARs and vaccines integrate, where CARs are very powerful effector cells, but they're very narrow in their restriction, at least in many of the formulations that we have, and they are often hyperstimulated and don't last long. Vaccines are, in some ways, a more sort of biologically based form of stimulation, but you're dependent on effector cells that work, and you have the poisoning effects of the microenvironment. So might you be able to pair an effective effector cell with a better strategy for stimulation? What are the settings different from each other? Is a smoldering myeloma setting, for instance, different than an advanced leukemia setting? And what are the different parameters that one needs to understand in terms of immune signature that will help sort of inform that? And so that will then determine how we can rationally combine therapies. So I think much in the same way that chemotherapy in its heyday went from using individual single agents to saying, well, what are the different mechanisms here, and how do we create sort of ways to approach therapy that ended up being, very important in certain diseases, at least, whether it's lymphoma or testicular cancer or leukemia. I think we're in almost a similar stage right now in immune therapy of trying to understand what is the environment, what are the challenges, how do we put pieces together that could be effective. So I think, honestly, both of the sessions are going to talk about that. I think that the Meet the Professor will be a little bit of more of, I imagine, a discussion of that principle, but then a back and forth, and the didactics will be a little bit more of a, sort of talking a bit about the field.